Lab is pretty unique. I don't know if you guys ever think about the lab before. It's sort of the background in the, mostly people ask me about crime scenes, stuff like that. That has nothing to do with what I do. I don't want to go to a crime scene. Crime scenes come to me. They show up in the ER, they show up in a hospital bed. These are the different areas that I'm just going to touch on. There's currently, I counted 22 different divisions of the laboratory. We're becoming more and more specialized. We're becoming more and more unique in how we treat patients based on all the different techniques that we use to take care of patients. One thing is that the treatments that we use, or the treatments that we develop for our patients, about 2 out of 3 treatments are based solely on laboratory results. So we got to make sure that we get to the right information about the right patient at the right time. Pathologists, specimen management, let's start there. That's the person that's going to be taking your sample and processing it, making sure that your name and date of birth and all of your information are on your sample and that it matches up, because what we do is we slap a barcode on the sample, we let the machines run what's going on, spit out the results, and we get it back to the physicians and nurses. Pathologist is our laboratory doctor. They're our medical director for the lab. Like I've told people before, they're probably one of the most educated physicians that there are in the field. People think about surgeons and anesthesiologists and how much school they go to. Our pathologists are probably their go-to person for stuff that they have trouble with. They go to 4 years of medical or undergrad, then they go to 4 years of medical school, then they do a 4-year residency program as a pathologist. After that, they can choose if they want to go into more school, so that way they can be either a microbiologist, pathologist, or a hematopathologist and work with blood cancers and such. There's a lot of different divisions that the pathologists take part in: histotechs, molecular, I could go on and on. Which brings me to these two here. Like I told the previous class, histotechs and cytotechs, even medtechs don't know what they do. They're so behind the scenes. They deal with tissue samples and cellular samples on a whole molecular level, staining procedures, and making sure that they're coming up with the right diagnosis for a patient. We do hundreds and hundreds of pap smears, and you shouldn't even use the word smear anymore because it's so archaic. We develop new processes so quickly that the terminology sometimes travels further than the actual sample. Lab information system, that's what I do now. Like I was telling you guys before, LIS, we work with the laboratory computer system to talk to all of the different computer systems throughout the country and throughout the world. What's interesting is that I've gone to different conventions and stuff and talked about the different EMRs, which are the electronic medical records, making sure that we are getting information transferred securely. I don't know if you guys remember back in November or December, there was a hospital that was in Hollywood that was hijacked. What happened is that some people got in behind the firewall of that hospital system, and they held everybody's medical records for ransom and said, nope, you can't treat this person, you can't look at their diagnosis, you can't do anything with their stuff until you pay us whatever amount of money it was. The thing is that when you get in behind certain firewalls, you start leaving a record, and the longer you're there, the quicker your record is picked up, and they'll find you and prosecute you, as they should. There's some hackers that just get in and mess with stuff just because they can. I don't know why. I mean, if they were hired on and to help prevent that stuff, they'd have a much more lucrative career. And it's a lot nicer out in the real world instead of behind bars. The leadership team, these folks make a lot of decisions all the time, every day. They collaborate with other areas. Right now, CHI, we collaborate with all of our greater Nebraska folks like Good Samaritan in Kearney, St. Elizabeth's in Lincoln. I can't even think of all the other ones that we talk to. We have a lot of outreach programs that we collaborate with, so that way we can perform laboratory tests at a much better cost for patients and for the lab, so that way they can function. Rural areas, it's hard for them to bill for certain things because they've got such limited access, so we can kind of come on as a big group and help them along. Sales and field reps, these are folks that come in with brand new stuff and they want to say, hey, we've got a new test that we are running right now, and it's showing such a great prognosis for patients that have this certain kind of disease. Then they're doing their job to make sure that they can sell our laboratory's new products. Technologist, technician, and phlebotomist, this is kind of my forte. This is what I've dealt with every single day for the past 10 years. As a technologist and a technician, you're the one that's performing the test. You're the one that's putting out the results and making sure that they're accurate and that you've done all of your background work on your machine to make sure that it's performing optimally. Phlebotomist, this is probably what a lot of people think of when they think lab. Someone's gonna come in and draw my blood, they're gonna, leave a Band-Aid on me, and then they're gonna walk out the door. There's a lot more to it than that. That's part and parcel of what the position is that's why we don't really keep too many people at a phlebotomist level. They come in, they learn what's going on, and they move on to something else because there's just, they get really good at it, and they get all the on-the-job training that they need to progress. Client services, like I told the previous class, they deal with a lot of customer service stuff, people that have had problems with their labs. So if I'm not doing my job, I'll find out from them that there's something not going to the right place. Either a fax number needs to be changed, or maybe some doctor's office brand new is opened up and they need to have their stuff taken to their facility. Client services will help facilitate all of that. Like I said, these are just a few of the ones. There's 22 that I counted the other day that are actual laboratory professionals.